Chip down.
According to the National Institute of Mental Health, an estimated 26.2% of Americans ages 18 and older, which is about 1 in 4 adults, suffers from a diagnosable mental disorder in any given year. That means that 57.7 million people in the U.S. have a mental illness. Today I would like to talk about some of the signs and symptoms of the two most common mood disorders, depression and bipolar disorder. It is important to know and understand depression and bipolar disorder, not only because they are the leading cause of disability in the U.S. and Canada, but also because both conditions can lead to suicide. After taking a psychology course, I became very interested in mood disorders and did some independent research, and I would like to share with you what I have learned. First, I will be informing you of the signs and symptoms of clinical depression, and then I will do the same of bipolar disorder. After that, I will discuss some of the treatments used for both. So let's start with depression. Depression is a serious mental illness. It is not something that you have made up in your head, and it is more than just feeling down or blue for a couple of days. In fact, according to the National Institute of Mental Health's website, some symptoms of depression are persistent sad or anxious moods, feelings of hopelessness and pessimism, and feelings of guilt, worthlessness, and helplessness. Visualizing Psychology by Surrey Carpenter states that clinically depressed people often feel so deeply sad and discouraged that they often have trouble sleeping and become so fatigued that they cannot go to work or school and often cannot even brush their hair or brush their teeth. It is important to understand the effects of depression because they can be so profound that a depressed individual can feel so sad and guilty that they consider or even attempt suicide. But depression can not only exist by itself, it can also exist as one part of bipolar disorder. Someone with bipolar disorder will swing between states of severe depression to a state completely opposite known as mania. When describing a manic state, the Substance Abuse and Mental Health Services, which is a branch of the United States Department of Health, states that when manic, the person feels a euphoric high. They sleep little. In fact, they can go days without sleep without ever feeling fatigued because of an abundance of energy. They have racing thoughts and unrealistically high self-esteem. And feelings of invulnerability lead to poor choices and high-risk impulsive behaviors such as spending sprees. A manic episode may last a few days or a few months, and it generally ends abruptly. That is when a person with bipolar disorder will swing into a depressed state. After the depressed state, the bipolar person might go through a period of normalcy, but then will swing back to the manic state, continuing the cycle all over again. Bipolar disorder can be one of the most debilitating and lethal disorders, with a suicide rate between 10 and 20% among sufferers. Now that you have a better understanding of clinical depression and bipolar disorder, I would like to talk about the different treatment methods used. Both depression and bipolar disorder are believed to be chemical imbalances in the brain and can be treated and controlled by medication and therapy. Depression can be treated with medication commonly known as antidepressants. Antidepressants basically just block bad chemicals and release good chemicals in the brain. Bipolar can also be treated with antidepressants, along with a mood stabilizer such as lithium. The mood stabilizer or mild sedative is used to treat the manic state. Along with medication, therapies such as cognitive therapies have helped people suffering from depression and bipolar disorder lead happy, normal lives. Depression is persistent feelings of sadness and hopelessness, and bipolar is when someone swings between depression and mania, but both can be treated. I have informed you of the signs and symptoms of both depression and bipolar disorder and some of the treatments used for both. Mood disorders are nothing to be ashamed of. So if you or anyone you know has or may have clinical depression or bipolar disorder, please seek help.